So the first question says that which of these antiviral is not used in managing HIV and AIDS?
A.
Acyclovir. Yes, correct answer. That's the answer. So what's acyclovir used in managing?
Apes, apes.
Herpes. Any chemical agent that destroys or inhibits the growth of pathogenic microorganisms in non-living objects is called
Mm.
disinfectant.
So,
Disinfectant. If you had said it, I didn't hear you, but the answer is disinfectant. You use disinfectant on surfaces, on the floor.
okay.
Question 3. The following are narcotic analgesics except.
Ketoprofen.
All right, good. So what class does ketoprofen belong to? NSAID, non-steroidal anti-inflammatory drug, just like ibuprofen. It belongs to NSAID, non-steroidal anti-inflammatory drug. You should know that there's a similarity in the name, ketoprofen, ibuprofen. So it belongs to the non-steroidal anti-inflammatory drugs. Drugs that slow down the CNS to produce calming effect without producing sleep are termed
Hypnotic.
no, sedative. The answer
Without
is
producing sleep.
yes, without producing sleep is sedative. The word hypnotic means to sleep or to produce sleep, while sedative means to calm down, to calm something down. It has a calming effect. That's the difference between sedative hypnotics. When they say hypnotics, what you are trying to achieve is sleep. So that's why even sedatives, they always use the word anti-anxiety. You are anxious when you are restless. You don't know what the outcome of an event, of an incident will be. You are just pacing up and down. So to make the person calm down, you use sedative. Which drug is a barbiturate?
Phenobarbital.
Phenobarbital. Good. The route of drug administration, where the drug is directly delivered to the lung, is called
Inhalation.
inhalation. Good. Inhalation. Which of the following drug is an anti-epileptic?
Carbamazepine.
Yes, carbamazepine is an anti-epileptic. The common brand name is Tegretol. Tegretol is an anti-epileptic. One of these is not a local anesthetic agent. One of these is not a local anesthetic agent.
Ketamine.
Ketamine, even merely seeing the ending of the other ones, cane, 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 at least it should give you some idea that ketamine may be the odd one out. Ketamine is given by injection, intramuscular injection. Although all these two, they are given by injections. But ketamine is for systemic effect, while lidocaine is for local effect. Bupivacaine is for local effect. It's usually given as intraspinal or intrathecal. Then procaine is for local. Which antioxidant drugs block antihistamine receptor?
Ranitidine.
Ranitidine. What kind of histamine receptor does it block? H1 or H2?
H2.
All right, good. H2 receptor blocker. The following are anti-malaria drugs except
Ivam. See?
ivermectin. Correct. Okay. Which of the following is not an antibacterial agent? Which of the following?
Sulindac. A.
So what class does Sulindac belong to?
Is an NSAID.
Sulindac is an NSAID, correct. Example of benzodiazepine is
Example of benzodiazepine. Lorazepam.
lorazepam, correct. That's the example of benzodiazepine. Chemical substance that destroys or inhibits the growth of microorganisms on living tissues without causing injury to the body is called
Antiseptic.
antiseptic, correct. Antiseptic. Zafelucast as an anti-asthmatic belongs to which class? Zafelucast as an anti-asthmatic belongs to which class?
I don't know.
If I'm calling it taught you now, it belongs to leukotriene antagonist, receptor antagonist. Leukotriene receptor antagonist. You have zafelucast, montelukast. All this belongs to leukotriene B receptor antagonist. All of the following drugs are used to manage epilepsy, except
Aminophylline.
so what's aminophylline used to manage?
Asthma.
Asthma. Which of the following drugs is not used to manage migraine headache?
Ibuprofen.
A. Ibuprofen is used for
Sorry.
ergometrin. Ergometrin is not used to manage headache. You use ergotamine to manage migraine headache. There's one old drug, Cafegot. That Cafegot contains caffeine and ergotamine. That's why they shortened it to Cafegot. Caffeine plus ergotamine. So ergotamine is used to manage migraine headache, but ergometrin is not used to manage migraine headache. What's ergometrin used for? Ergometrin can be used to manage postpartum hemorrhage. Postpartum hemorrhage means the bleeding that occurs after a woman has given birth or after a woman has been delivered. Excuse me, please. Okay, which of the following drugs is not a neuromuscular junction blocker? What's the answer?
Baclofen.
Baclofen, yes. Although baclofen is a muscle relaxant, but it is not a neuromuscular junction blocker. Okay, baclofen is not a neuromuscular junction blocker. Select a potassium sparing diuretic among the following drugs.
No.
Anybody?
Amiloride.
Amiloride. Why are you finding it difficult to answer this question? Is amiloride
No.
now? Amiloride is a potassium sparing diuretic, and that's why you add it to hydrochlorothiazide to give us which popular drug? Amiloride plus hydrochlorothiazide is what drug?
Moderatic.
Moderating. You people have gone for practical twice, and you are still booting to answer this potassium sparing diuretic. Can you give me other examples of potassium sparing diuretic?
Spironolactone.
Spironolactone, good. Any other one? We also have triamterene. What class does furosemide belong to? Yes, what class does furosemide belong to?
Loop.
Loop diuretic. Okay. Why the bendoflumethiazide and hydrochlorothiazide are thiazide or thiazide-like diuretics. All of the following are class 1 antiarrhythmic drugs, except all the following are class 1 antiarrhythmic drugs, except digoxin. Digoxin is not a class 1 antiarrhythmic drug. All right.
Yes, sir.
Question 20. You know what arrhythmia means now? You know what arrhythmia means?
No.
Arrhythmia means irregular heart rhythm, irregular heartbeat. If it is fast, we call it tachycardia. If it is slow, we call it bradycardia. Okay? I taught you the electrical activity of how the heart beats. So which structure is the heart pacemaker? What did I say is the heart pacemaker? Anybody? I said the sinoatrial node. Sinoatrial node. SA node. You have not been reading. You're just attending classes. Anticoagulants are drugs that Anticoagulants are drugs that
Blood coagulation and something blood coagulation. This one is on air. The group coagulating.
anticoagulants are drugs that
A.
prevent blood from clotting,
The
thereby
blood
cause
from
thrombus.
clotting.
They do not cause thrombus formation. They prevent or inhibit thrombus formation.
Okay, let's see.
Thrombus is something that can block the blood vessel, so they cannot form thrombus formation. If they are trying to prevent the blood from clotting and they form through, when the blood clots, there will be thrombus formation. So if they prevent the blood from clotting, then they also inhibit thrombus formation. So C is the correct answer. Question 21, choose the calcium channel blocker. I want to believe that you people are just
Nifedipine.
I want to believe that you are just keeping quiet. It's not that you don't know this. I expect you give me the answer without thinking. Okay. Which drug is an antithyroid drug?
Carbimazole.
Carbimazole, excellent. Good. It's an antithyroid drug. Okay. Metformin is an anti-diabetic drug. As an anti-diabetic drug, belongs to which of the following class?
Biguanide.
Yeah, biguanide. The management of type 1 diabetes mellitus is best with
Insulin.
no, it's not glibenclamide, it's insulin. Type 1 diabetes mellitus is caused by autoimmune destruction of beta cells. So you have very low or no insulin. So you need to always give insulin to the patient because insulin is very low or is even absent. Okay?
Yes.
So you cannot manage with oral medications. You cannot manage type 1 with oral medications. You can only manage with insulin injections. The patient has to keep using insulin injection. Okay? And there are several types based on the duration of action. We have short acting, intermediate acting, we have long acting based on their duration of action. So you use insulin to manage type 1 diabetes because it's an autoimmune destruction of pancreatic beta cells, which makes it impossible for them to make insulin. Now, if you say glibenclamide, some of these things, they are insulin secretagogues, meaning that they enhance the production of insulin. Then some of them ensure that the liver takes up glucose from the blood. Okay, so if the pancreatic beta cell is being destroyed and you are giving drug to make them secrete insulin, they will not, because they are already destroyed. So you need to use insulin. All are female sex hormone analogs except all.
Methyl testosterone.
Yes, anything testosterone is male. Methyl testosterone. The natural birth control method among the following is the natural birth control method among the following is
Natural.
It's straightforward. The answer is staring at you. Lactational amenorrhea lamb. I told you when I was teaching you that when a woman is breastfeeding, lactation, that it confers some level of contraception. I can't remember the topic where I taught you this, but I know I mentioned it. Maybe under endocrine system. It should be under endocrine system anatomy. I said that when a woman is breastfeeding, it confers some level of contraception. So the woman is not expected to get pregnant, okay? But like other natural birth control methods, it can fail, okay? Like, who can give me other examples of natural birth control methods? Other examples. Yeah, coitus interruptus. That's withdrawal method. Coitus interruptus is the withdrawal method. It's when the male withdraws before ejaculation. That coitus interruptus is also a natural birth control method. One of the following is a pharmacological method of contraception. What?
Oral contraceptive.
Oral contraceptives, good, because they are pills. All are macronutrients except macro. All are macronutrients except
Vitamins.
vitamins. What are vitamins?
Vitamin B4.
Vitamins are micronutrients. Okay, vitamins are micronutrients. 29, vitamin B4, correct. All are vitamins except vitamin B4. What is another name for vitamin B1? What's another name for vitamin B1?
Thiamine.
By now, he likes to take these vitamins and minerals. So vitamin B2 is what?
Flavin.
What?
Riboflavin.
Riboflavin. What's vitamin B6? So yes, quickly Google it. What's vitamin B6? What? Pyridoxine. What's vitamin B9? What's vitamin B9? Oh, yeah, Google. Vitamin B9 is folic acid. Folic acid. The element responsible for thyroid hormone synthesis is We have done this before. It's a repetition of the question. What?
Iodine.
Iodine, C,
Iodine.
yes. A form of malnutrition. A form of malnutrition characterized by marked energy deficiency is
Marasmus.
Marasmus.
the answer is marasmus. The vitamin that plays a major role in tissue repairment following injuries.
Ascorbic acid.
Yes, because of tissue repair and collagen formation, ascorbic acid. Which of the following is not an indication of corticosteroid?
Used as immunosuppressant.
Are they not used as immunosuppressants?
Arthritis. Treatments of rheumatoid arthritis.
Abi?
They are used in treating rheumatoid arthritis. They add prednisolone to rheumatoid drugs.
Funny. This thing is working hard. I don't know.
The answer is treatment of immunosuppression, something that suppresses immune system. You cannot use it to treat immunosuppression. Is it not logical? Since I said they are used as immunosuppressant, what can suppress the immune system? You cannot use it to treat immunosuppression. Does it make sense?
No.
So that's the treatment of immunosuppression. If you are trying to treat immunosuppression, it means you are trying to boost the immune. Okay. Example of naturally occurring anti-cancer drug is
Naturally occurring.
yes. Example of naturally occurring anti-cancer drug.
Methotrexate.
No. Where is methotrexate discovered from? Is it discovered from any natural source?
Yeah.
The answer is paclitaxel. Paclitaxel. The drug used to induce labor by stimulating uterine contraction is
Oxytocin.
Oxytocin.
Excellent. Dash is a drug that can be used in treating bacterial infection.
Cefuroxime. Cefuroxime.
Cefuroxime, good. One of the following is a centrally acting muscle relaxant.
Not pancreas.
No, pancuronium is a neuromuscular blocker. We have treated it above. If you treat pancuronium, then that means hexametonium 2 is right, and tubocurarine is right. The answer is baclofen. Give me a few seconds. All but one of the following are true with NSAIDs. All but one of the following are true with NSAIDs.
It means non-steroidal anti-inflammatory drug.
And it's true now. They say all but one. So which one is not true? All but one of the following are true.
Okay, except okay.
They beat Cox enzymes.
It's true, they do.
All
All of them are true. Let's leave the question. The Greek word pharmakon and logos From which from which the term pharmacological was derived. What does it mean?
Study of drugs.
Copy of drugs.
Study of drugs. Yeah. This is not a determinant of the fate of medicinal interactions between a medicine and living system.
This is the determinant of the fate of medicinal interaction.
Pharmacodynamics. Abi, what the body does to the drug, what does to the body. God, I go. Wait. Wait.
Yeah.
Anyway. Receptor affinity.
That's the answer. 40 receptor affinity. That's the answer. The action of medications on a human body is termed
Pharmacokinetics.
the action.
That's it.
Oh, sorry.
41.
The action of medications on human body is termed is pharmacodynamics now.
Pharmacodynamics.
What the drug
sorry.
does to the body.
The body.
Yeah.
Omowe.
Which of these drugs naming is the same in 2 or more countries?
The same in two more chemical. Is it chemical structure? Chemical structure.
Generic name.
Yeah.
Is generic name not the same everywhere?
Okay, my lord.
Yes, my
Metformin-
lord.
Metformin is metformin everywhere. That's a generic name. Brand name
Okay.
and proprietary name are the same thing. Brand name, proprietary name means the same thing. So you can't pick that. Then the chemical structure of one drug is different from the chemical structure of another drug.
Okay.
Expertise is required in the use of the following routes. 43, wait. Expertise is required in the use of the following routes. Expertise, question 43, is required in which of the following routes?
Rector.
You need expertise to insert in something into the rectum.
Parenteral.
It's parenteral now. You need expertise to inject. You can call a small boy to help you insert something into your anus, but you cannot give a small boy injection to inject. The most allergenic route of drug administration is what do you say? What is the most allergenic?
Plasma.
Who they watching? What's the answer?
Sublingual.
No. I remember I know the answer.
Okay.
It's subcutaneous.
I said it.
Oh. Take off.
Which of these methods of drug intake is most popular?
Drug food interaction.
45,
Ah.
yeah. 45.
45.
Oh, sorry.
Aura.
Oral.
Sorry.
Ombe.
Sorry, my lord.
Which one of these is not of interest on patient-drug relationship?
Wait, right?
Ah.
Which one of these is not of interest on patient-drug relationship?
Which one of these?
Drug laboratory interaction.
Drug laboratory
drug
interaction. All are implicated in the management of respiratory system except
Oh, I'm looking for hypnotics.
what?
She
You
said
won't- you won't-
hypnotics.
He said or you said?
She said.
Do you agree with, do you
He
agree with
should
what
be
he
for
said?
you. I don't know, sir.
You see happiness in class, what?
The answer is hypnotics.
Okay.
An example of a long-acting respiratory tract medication includes
An example of long-acting respiratory. Maybe
the coin to the 200 level.
long-acting. Samentero.
Yeah, salmeterol. That's a long-acting salmeterol. Okay. All the other ones are short-acting. Patients having motion sickness are best treated using first off, what is motion sickness? What is motion sickness? You know,
Travel sickness.
some people travel and they start vomiting in the vehicle.
Yes.
That's what you refer to as motion sickness. They will say,
Promethazine. Àti sọ tẹ́lẹ̀ yín lẹ gbé.
I had under citron. I didn't hear any promethazine.
No. Under citron. Okay.
I had somebody say under citron.
No, not here.
Hey. I took be wrong in the Zoom.
Like,
Oh God. So is promethazine meclizine a situation where individuals need a drug to function effectively is termed? What's the answer?
No, drug
Drug dependent. And I'm asking again, you didn't reply.
I might be my lord.
A mood disorder is called
a mood disorder is called
It's
psychosis.
psychosis. Good. Cocaine is a typical excuse me. Cocaine is a typical
CNS stimulant.
CNS stimulant. Good.
Okay.
Medicines are best defined. Medicines are best defined as
Agent that can satisfy the emotional needs of patients. Expenses of the manual treatment of
B.
B. B. Agents used.
B. Which of the following drugs can be obtained from animal sources?
Insulin.
Insulin, good. One of these drugs is used for the management of schistosomiasis.
Schistosomiasis. B.
Praziquantel, good. That's when you are urinating blood due to
Yeah.
schistosoma hematobium. Okay? And you get it from swimming in water infested with schistosoma hematobium. From the name itself, hematobium, hema means blood. Okay? Drugs that stop the growth and or multiplication of microorganisms are said to be
Stop the growth. Bacteriostatic.
bacteriostatic. A. The following are H2 receptor antagonists except
Loratadine.
loratadine. Good. Orphan drugs are yeah, there is orphan drug. Orphan drug.
One.
Drugs are regular without the pharmaceutical class.
Drug without the pharmaceutical class.
There is no
Pharmacology.
there's no pharmaceutical here.
Pharmacological class.
A pharmacological class.
The answer is drugs used for the treatment of rare diseases.
Oh, one.
Any drug that is used for the treatment of rare disease is an orphan drug.
Okay.
It's an orphan drug because most companies don't want to produce it. That's why it's an orphan drug. Most companies don't want to own it. They don't want to produce it. The parents of drugs are pharmaceutical companies. That's the parent of drugs. They give birth to drugs, the pharmaceutical companies. So once pharmaceutical companies decide not to produce a drug because it's used for rare disease, you know there are over 7 billion of us in the world. So let's say there is a disease that affects 100,000 people. Do you think pharmaceutical companies will want to produce that drug?
No.
Because you must have what we call ROI. ROI means return on investment. Okay? That's it, return on investment. So if you are investing your billions of naira in producing a drug, and the drug is just affecting 100,000 people, you go will now catch the person. The 100,000 people should be poor people. You know you have run, the company has run at a loss. So nobody wants to claim a drug that is used for rare disease. So the drug is fatherless, is motherless. All right?
Okay.
Synergism in antimicrobial combination results in
is it increased pharmacological?
yeah, increased pharmacological effect. All are examples of anticoagulants except
Xarelto ni enoxaparin.
one of these is a permanent family planning method.
Vasectomy.
Vasectomy. See. What's vasectomy?
Removal of vas deferens.
Winner.
62.
62. The following drugs can cause peptic ulcer except
Magnesium.
Good. Examples of quinolone antibiotics include all of the following except
Ceftazidime. Abi.
Ceftazidime. Ceftazidime.
Eh,
What class does ceftazidime belong to?
no, magari. Sephora, ṣebí class àwọn sephoratism yẹn náà ló máa wà.
Belongs to cephalosporin. The study of the adverse effects of chemical, including drugs on living systems, and means to prevent such effect is called
The adverse effects of chemical, including drugs or
The study of the
necessary.
effect of chemical related drugs on living
I
systems.
explained this thing. If you check my AUM studio, AUM video that I took on introduction to pharmacology, the answer is toxicology. Toxicology. You people are just piling up videos. You are not even watching. Once the class is over, it no concern you. Leaves of Digitalis purpurea plant are the source of which drug?
Digitalis.
Nicotine.
Yeah. What does the term bioavailability mean?
Abi.
There is no Abi.
See, fraction of drug that reach systemic circulation.
Very good. Fraction of drug reaching the systemic circulation. Which of these is an ARV combination? First, what is ARV?
Antiretroviral.
So which of these is an ARV combination?
Zidovudine and what's this? Oh, Shekiri.
What's the answer?
Yeah. Antiviral drug, not near cyclover, but I don't know. Zidovudine. What a big one.
We said antiretroviral. Which one is antiviral again?
Sorry, sir.
Which of these is an ARV? You were the one that told us ARV means antiretroviral.
Yeah.
So
Yeah.
they are no more. Yeah. What is cotrimoxazole?
Septrin.
Septrin. So
Okay.
is he more? Yeah. Then what class is ketoconazole? What class is ketoconazole?
Antifungal.
Antifungal. So I agree more. Yeah. There is no more. Yeah. No party for jungle.
Only the survivor of the fittest. See?
C. Zidovudine nevirapine. Acyclovir is an antiviral, but not an antiretroviral.
Yes.
It's used for herpes. All are examples of antidepressants, except fentanyl. What class does fentanyl belong to? Opioid. Beneficial effects of NSAIDs include all, but one of these.
Anesthesia.
Excellent. Anesthesia. They are not anesthetic agent. Which of these antihypertensives should be given with great caution in asthmatics? Because beta agonists are anti-asthmatic drugs. So you should be careful of beta antagonists. So which one of these is a beta antagonist? Of these antihypertensives should be given with great caution in asthmatics. I've given you a clue. I said beta agonists like salbutamol are used for asthmatics. So if you should be careful with any drug, you should be careful with beta antagonists. So which ones are beta antagonists?
Propanolol.
Propanolol. That's the answer. Propanolol. Sorry. This first one should just be amlodipine. It must have been a mistake while typing. It's not amlodipine propanolol, it's propanolol. The most common treatment for TB is the administration. The most common treatment for TB. What's TB?
Tuberculosis.
B.
Yes. INH. What is INH?
Isoniazid, abi?
Isoniazid, rifampicin, pyrazinamide, and ethambutol. That's the answer. B. Which of these has the tendency to cause dry cough? Enalapril, ACEIs, angiotensin converting enzyme inhibitors have the tendency to cause dry cough. ACEI, the answer is enalapril. Type 2 diabetes mellitus is best described as. Type 2 diabetes mellitus is best described as. The body, there is no, the body is producing insulin, but the body is also resistant to it. So it's insulin resistance by body cells.
Yeah.
But in type 1, there is complete cessation of insulin production. Which of these drugs is a typical antiviral agent? Which of these drugs is a typical antiviral agent?
Famiciclovir.
Famciclovir, abi?
Famciclovir, good. The following are corticosteroids used in the treatment of asthma, except
The question again, sir.
the following are corticosteroids used in the treatment of asthma, except.
Promolene.
So what class does cromolyn belong to? Is a mast cell stabilizer. Mast cell stabilizer. All this can be used to treat vomiting, except.
Like. Hey, get up.
All the answer. Carbidopa, A. Carbidopa is used in conjunction with levodopa in the treatment of what condition? In what condition do you use levodopa, carbidopa? In Parkinson disease.
Disease.
Examples of adjuncts to analgesics. Examples of adjuncts to analgesics include one of the following. Question 77. Examples of adjuncts to analgesics include all but one of the following.
Pregabalin.
Azithromycin. Azithromycin is an antibiotic. All these other ones, you can add them for neuropathic pain arising from nerve in the body. Gabapentin, pregabalin, tizanidine can be used as adjunct for analgesic pain. Tizanidine is more of a it's more of a muscle relaxant, sorry. The choice of antidepressant depends on the following, except the choice of an antidepressant depends on the following, except question 78.
It's not expiry date.
That's the answer, expiry date. Proton pump inhibitors include the following drugs.
Ranitidine.
Except, yeah, there's supposed to be except here. So except ranitidine. The following are beta-lactam penicillins, except azithromycin. Azithromycin is a macrolide.
Yes.
After administering a drug, the time when the body first starts to respond to the medication is called
Onset of action.
onset of action. All the following can be used in the treatment of infectious infections, except
So the options no.
is antihypertensives. I didn't deliberately take it away because the answer is here. Antihypertensives, they are not used for treating infection. No?
Yes, sir.
Which of the following is not a diuretic?
Mesna.
So what is Mesna? Huh?
We don't know it.
The way you rushed it as if you knew it. That's how I'm asking. But it looks like the odd one out, so lucky you. Lucky you. Question 84. An overdose of warfarin can be treated by administering vitamin K. Vitamin K. 100% bioavailability. It's possible in that route of drug administration. 100%. What? Intravenous. Which of the following would a patient be prescribed an albuterol inhaler?
Asthma.
Asthma. Amitriptyline belongs to one of the following therapeutic classes. Antidepressant. Those medications for which a physician prescription is not required is called
OTC medicine.
OTCs. These drugs, which are used for body temperature, are called those drugs. A, analgesics. What was the answer? Drugs used for body temperature.
Antipyretics.
Antipyretics. Pyres means fire. Something hot. Okay? The unexpected reaction of any drug is called you are not expecting, I never expected it.
Side
Like,
effect.
You expect side effects. Did I send you the video on introduction to AUM? AUM 122. I explained all of these things there. This is idiosyncratic, not side
Yes, so
effects. For side effects, you are expecting it to happen. Like if they say Cipro is, the side effect is headache. It's not when you now start having headache. Are you not expecting it? Because you already know the side effect. If they say the side effect of this thing is going to make you hungry, it's already known. So if it happens to you, it's not unexpected. But unexpected are things that just happen. Idiosyncratic reaction. An undesirable effect of the drug that occurs at the therapeutic doses and can be predicted from its pharmacological action is undesirable. Eh? Side effect.
No, that's not what I'm saying.
High plasma protein binding makes the drug long acting. Makes the drug long acting. 93. Prescriber related factors that contribute to irrational use of drugs are as follows, except the one that relates to the prescriber, to the doctor. The answer is D, availability of essential drugs. You know, concerned doctor, this is a concern for pharmacists. Okay? So let's go to 94. One of the drugs below reduces blood pressure by acting on vasomotor centers in the CNS. So it's a centrally acting. Hey, there are two people in the same room now. That's why we're having that sound. Two people are in this class from the same room. Okay. So one of these drugs below reduces blood pressure by acting on vasomotor centers. Size clonidine. Clonidine in the CNS. It is a centrally acting rather. All of the following are centrally acting and antihypertensive drugs except minoxidil. Minoxidil. Choose the selective blocker of beta-1 adrenoceptors. Choose the selective blocker of beta-1 adrenoceptors. We have sorry. I didn't know my hand had pressed it. The answer is atenolol. Which of the following drugs do not inhibit the angiotensin converting enzyme?
which of the following drugs do not be
Losartan.
Losartan. Pick out the diuretic agent for hypertension treatment. Pick out the antidiuretic agent for hypertension treatment. Sorry, the diuretic. Hydrochlorothiazide. Volume of plasma from which the drug is completely removed per unit time is
Volume of distribution.
Oh, Jesus
It's
Christ.
clearance. Clearance. The most common mechanism of drug absorption in GI tract is the most common mechanism of drug absorption in GI tract is passive diffusion. Passive diffusion. Okay, so we have come to the end of today's meeting. See you guys some other time.
Thank you.